Hello friends, welcome to a new lecture today. Now I would like to, this is a continuation of drugs in pediatrics. In that I would like to discuss about sodium bisulphide, which is also called as vitamin K. Okay, so this dosage of this sodium bisulphide, which is given bisulphate of sodium bisulphide or no. So vitamin K, it is dose is 1 milligram per kg IM. Okay, so this sodium bisulphide, it is used. What is the use of this sodium bisulphide? It is used in all normal newborns. Okay, has vitamin K prophylaxis, and then it is also used for prophylaxis and treatment of hemorrhagic disease of newborn. It is also used for prophylaxis and treatment of hemorrhagic disease of newborn. Then it is also used in bleeding tendency. It is also used in bleeding tendency with liver disorder. Okay, then it is also used in deficiency of clotting factors. And these clotting factors should be vitamin K dependent clotting factors. Now what is the side effect of vitamin K? Excess vitamin K administration can cause hyperbilirubinemia in premature infants. It can cause hyperbilirubinemia in premature infants. Okay, so this is about vitamin K. Thank you guys for watching my lecture. Thank you.